What's going on, everyone? Welcome back to my channel. My name is Dr. Tom Walters and I'm an orthopedic physical therapist. In today's video, I'm going to be teaching you 5 of the best stretches and exercises for tailbone or coccyx pain. So if you've got symptoms in that area, stay tuned for today's video. For our first exercise, we're going to use a ball. You can use a pinky ball like this, a tennis ball, a lacrosse ball to mobilize the deep rotator muscles of our hip joint. They run across the buttock region and attach near the tailbone. So what you're going to do is take the ball and you can work both sides, or if your pain's just more on one side, focus there. You're going to put the ball on the ground just off. So right, your tailbone's going to be directly in the center. You're going to go just off from that and then kind of sit on the ball and work right along the edge of the tailbone, right along the edge of the bone there, and look for tender spots. If you find something that's tender, you can pause on it, hang out for 10 to 20 seconds, take some deep breaths, and try to get those muscles to release and relax, which will help reduce pain. When you've been in one spot for a little bit, just roll to a little bit new one. The muscles attach all along that border of our sacrum and tailbone. So just kind of work your way through there and massage those muscles. This is something you can do every day. You could do it multiple times a day if it helps. But basically, it's sort of like doing a self-mobilization or self-massage of the deep rotator muscles. For our second exercise, we are going to stretch our glute muscles and again, those deep hip rotators. This is going to look very similar to a pigeon stretch if you've ever seen that before, with just kind of a slight modification. So if I'm stretching my right leg, I'm going to put that knee forward and I'm going to bring it closer to midline, kind of across the midline of my body. And then I'm going to kick my left leg back and slowly sink back until I feel a stretch out here in my glutes and deep in that posterior hip region. So just kind of sink back there. You can kind of play with your angle, move around a little bit until you feel a stretch in those glute muscles and deep hip rotators. When you find a good stretch, you're going to just hang out. You can put your arms down like this if this is more comfortable. You're going to hang out for 15 to 30 seconds. We want to perform stretches 2 to 4 times every day to help improve flexibility and reduce pain. So I'd encourage you, even if you just have pain on one side, do the stretches on both sides. You can kind of hold here for a second and then take a break and perform the other side. But basically, again, you're going to start out like this. Bring the leg across midline so we get a bit of hip adduction. And then you're going to kick back and drop down until you feel a stretch out here on this posterior hip region. Okay, so that's our second exercise, a glute and deep hip rotator stretch. For the third exercise, we are going to stretch our groin muscles or hip adductor muscles. For many people with pelvic floor and tailbone related pain, stretching the groin muscles can really help. So for this one, I'm going to put my right leg out. I'll show the stretch on my right side, so just reverse it if your symptoms are more on the left. I'm looking for a stretch right here in those adductors or groin muscles. I can start here with my arms up. If you get a good stretch here, you can just hang out here. If this is too easy, you can drop down kind of towards your forearms and then sit back. That's why this is called a rock back. You're going to kind of rock back into your hips and look to get a good moderate stretch right here in the groin muscles. So hang out for 15 to 30 seconds. You can hold longer if you want to. You could hold stretches out for 1 minute to 2 minutes. Just find what works best for you and helps your symptoms the most. You also can perform this several times a day depending on how much it helps you. Okay, so that's our third exercise, an adductor rock back to stretch our groin muscles. Before we get to the next exercise, just want to mention that my book is available on Amazon and Barnes & Noble. It has rehab programs for the 50 most common injuries and pain issues. Today we're talking about tailbone or coccyx pain. If we go into the hip chapter, you'll find this piriformis syndrome or deep gluteal pain syndrome. This will address the hip joint and the muscles that attach to the hip and around the sacrum and tailbone. Each program has 3 phases and has pictures of me doing all of the exercises and instructions. Basically a program like you get if you came to see me in physical therapy. So if you'd like to have a book that takes you through all the most common injuries and allows you to do your own rehab at home, I will put a link for the book down in the description. Our last 2 exercises, we're going to start activating and strengthening the muscles that run in the tailbone region, attach in that region. So this one's called a hip circle. What you're going to do is go into quadrupeds. You're going to be on your hands and knees, and then I'm going to use my glute muscles and those rotator muscles to perform circles of my hip joint. So I'm just going to take it through that full range of motion. Try not to move your spine too much. You're just trying to move the hip joint. and you're going to perform 10 circles like this, going forward, out through hip abduction, back into extension, all the way back, and then back down. Again, this is going to work all of the muscles that attach and run through the buttock region and towards the sacrum and tailbone. So go for, again, 10 repetitions, and then try to perform this for 2 to 3 sets throughout the day to activate and strengthen the glutes and deep hip rotators. For the last exercise, we're going to go back to targeting the adductors or groin muscles. We performed a stretch on them. Now we're going to contract and strengthen those muscles. So for this exercise, you're going to take a volleyball or a basketball, whatever you've got at home, put it between your knees, and then you're going to lie on your back. And we're going to do a bridge exercise, but we're going to squeeze the ball at the same time to activate and strengthen those groin muscles. So put your arms down here at your sides, squeeze the ball first, kind of brace your core just a little bit, and then push into the ground and lift up into a bridge all the way through full range of motion so that you have a straight line from your knee to your shoulder, and then back down, moving nice and slow. Again, squeeze the ball first and then lift up. So as long as you keep that squeeze on the ball, you can just go up and down and perform your bridges. This is going to strengthen our glutes, again, because we're performing hip extension, but the ball squeeze is going to bring in activity of those adductor muscles. So shoot for 10 to 15 repetitions. Basically just go until you're tired. If you experience increasing pain in your tailbone, then just stop at that point. And you're looking to do around 3 sets of 10 to 15 repetitions of this. This can usually be performed every day as well. All the exercises in this video can be done every day. Unless you have a flare-up in pain, then you could take a day off. Okay, so those are 5 exercises that often help people with tailbone-related pain. Give them a try. If you have any questions, put them down in the comment section and I'll get back to you. All right, you guys, see you in the next video. Bye.